I'm Chako Suzuki, and I am with RealSelf TV down in San Diego with America's top dermatologists, including Dr. David Amron. Hello.
Hello, Chako.
How are you, and what's your specialty? Where do you practice?
So I'm a dermatologic surgeon, so that's a dermatologist who focuses on surgical and cosmetic procedures, primarily liposuctions, basically most of my practice for 20 years.
Let's talk about body contouring and UltraShape. Can you tell me what is it, what does it do, what do women and men and our viewers need to know about it?
Okay, so UltraShape is really the latest non-invasive or non-surgical way of destroying fat. And it really works in a very specific way. It's really kind of smart bombing the fat cells and destroying them. And it's got some advantages. It's really painless as opposed to some other technologies. And it's more versatile, and it's quite effective. And I use my practice in very specific ways. But I really want to get across that, this whole thing is about proportioning of the body and the proper evaluation of the patient.
Okay, that's great. So how would you use UltraShape then for something like muffin top or, saddlebags? Is that the best machine to use, or what are the options?
Okay, so I think that UltraShape is about targeting smaller areas, one or two areas, and really somebody who does not want to do surgery. I've got to say that it's a great technology, but it's not going to compare to well-done liposuction. And again, it's about targeting your stubborn, disproportionate areas and creating balanced proportion for the patient.
So who makes a good candidate for this kind of treatment? And how much weight are we talking about? Like if you're looking at your body.
Okay, so again, I want to make clear that weight and being overweight and being out of proportion are two separate things.
Good distinction.
The weight thing and the muscle toning thing is the patient's responsibility. The targeting disproportion, whether it's surgically or non-surgically, is my responsibility to create that balanced proportion. So, UltraShape's good for somebody, again, who does not want to do surgery, who wants, mild to moderate improvement, and that's it. And
what about downtime? Any downtime with UltraShape?
There's no downtime, there's no pain with it. You're out and about right after the procedure. It takes about an hour to do. You usually do 2 or 3 procedures, 2 weeks apart. You see results as quickly as 2 weeks.
And with the technology, what is it using? There's radio frequency, there's heat, there's cold. UltraShape is?
Yeah, so it's using non-thermal ultrasonic energy to specifically go into the fat layer and destroy fat cells.
And how long do results last from UltraShape?
Another good question. So, you are destroying fat tissue. It's sort of like liposuction, not as complete, certainly. So the results, whatever fat you are destroying, is really permanent. And so it is a permanent reduction of the fat. Now, if somebody gains weight or is out of shape, those areas can get full, but the fat is not going to come back. And that brings up a very, very important point. It's got to be taken very seriously in terms of balance and proportion, because we now have the power to destroy fat cells non-surgically, also like liposuction. And if you don't approach it that way, you can create disproportion. The fat can go to other areas. And people hear that a lot. They get liposuction done, the fat goes to other areas. That's because the surgeon was not approaching it from a standpoint of balance and proportion, things I talked about. And that same thing needs to go on with non-surgical stuff. That's why the evaluation by a person who understands this is very important.
And what questions do you think it would be helpful for our viewers to be armed with when they go in asking about this procedure? Because a lot of them do ask about weight gain and where it's going to end up.
Okay, so the one thing I would say to the viewer is, do your due diligence, learn, understand things. Don't just go in only asking for one particular thing. Go into a doctor who you trust, who understands this, and ask them what they think. Are they a good candidate for either liposuction or non-surgical fat reduction? And get guided by a good consultation. I mean, get out of the mentality of like, I want to do exactly that. Get guided by the surgeon in terms of what is best for you individually, where your money is best spent. I got to emphasize that. I mean, it's all about targeted care and targeted value, whether it's surgical and even non-surgical, because this non-surgical stuff is great, but it can get expensive, and you can waste your money if you're not a candidate. And so be careful about being sold to by places and specials and promotions and this and that. I mean, get guided by somebody. Okay, great. And we're talking board certified. We're talking board certified, and ideally, past that, board certified by somebody who ideally understands it very, very well. I would say somebody who's does a lot of liposuction, and that's an important thing. I think if they don't do liposuction and they're trying to sell you on some of this stuff, they're not going to understand the area very well. So that's an important thing too. Board certified by somebody who does a lot of liposuction, understands balance and proportion well.
Great. Thank you for all that guidance. It was really great.
You're really good. I was very impressed with your questions. Truly.
Thank you so much. And if you'd like to learn more about Dr. David Amron, you can check him out on his RealSelf.com profile. Thanks again.
Thanks for listening.